Hello, my name is Dr. Michael Venice, DN, and I represent the American Naprapathic Association. You're watching an interactive call-in show brought to you live on cable channel CAN TV 21. Or you can stream it online at cantv.org/live. During the next 25 minutes, we're going to discuss low back pain, and specifically mechanical low back pain, which includes posture, the sitting posture, and things of that nature. And then also how napropaths can treat the condition. I invite you to call with your questions at 312-738-1060. Our phone lines are open. Now, Naprapathic medicine is a specialized system of healthcare founded by Dr. Oakley Smith. He was a chiropractor originally, and then he went in search of something that was helpful for his low back because chiropractic was not working. So it was developed in 1907 and employs hands-on manual medicine, nutritional counseling, and a wide variety of therapeutic modalities. Naprapathy focuses on conditions caused by contracted, injured, spasm, bruised, and otherwise affected myofascial and connective tissue. Napropaths are connective tissue specialists. The connective tissue supports and contains all the integrated structures of the entire body, including the tissue surrounding the spinal cord. It envelops muscles, organs, joints, and all the articulations of the body. Doctors of naprapathy use a threefold strategy in their treatments. Naprapathy uses manual medicine, which is a hands-on connective manipulation to the spine, joints, and articulations of the body. Nutritional counseling, recommended for holistic dietary changes, food supplements, herbs, vitamins, to assist the body in achieving optimal health. Therapeutic modalities are the last tool that we use, and it's the use of effective properties of physical measure of heat, cold, light, water, electricity, ultrasound, low laser, or cold laser. Some of the conditions that we treat are back pain, neck pain, hip pain, leg pain, sciatica, neuropathy, tension headaches, migraine, any soft tissue injury, tendonitis, that kind of thing. So now I'm going to go in and talk a little bit about posture and mechanical low back pain. So a lot of the conditions that napropaths see is due to long periods of sitting, and especially when people are sitting in poor posture. So they involve, because they're typically in flexion or leaning forward, there's a lot more load on the spine. So I'm going to show you a picture of the correct posture and a picture of incorrect posture. So here on the correct posture side, you see that the spine is in good alignment. So from the neck into the mid-back and into the lumbar, the curves are where they should be. So in the neck, the curve should go forward, or a lordosis. In the mid-spine there, going back toward the chair, is a kyphosis. And then into the low back, back to our lordosis. And so those curves need to be there to minimize the stress on the nerve roots coming out and the discs. In the incorrect posture, you see that the person is going into flexion or going forward, and the neck comes forward, putting more stress on the cervical spine, the neck, in the neck, the thoracic spine, and especially in the lumbar, due to that being the seat of the spine with the sacrum. So the thing is, we want to sit in correct posture because it minimizes the stress on the spine. And so when we're in good posture, then we minimize the load and stress on the nerve roots, and the muscles are able to hold us, and there'll be less pain going long term. Once again, the phone lines are open. The number is 312-738-1060. I'm going to show you another picture of a exercise that will help you correct poor posture with sitting. So this next picture is a person doing what are called wall angels. And so she's making contact with her hips, her upper back, with a little curve in the low back, and her head is against the wall. And so what happens is the feet can come forward. It'll pull you back into extension, because normally we're in flexion, and so you want to move out of that posture and go back into extension. So this is a great exercise to help correct the poor posture of sitting in flexion for long periods of time. So, like I said, that is a great exercise to correct the poor posture of sitting for long periods. So, some of the ways that napropaths treat mechanical low back pain is through manipulation, through electrical stim, doing soft tissue work, and also soft tissue manipulation to relieve pain. Typically, with some of these postures, can relate to pain down the leg, and through orthopedic and neurological testing, they can relieve that pain, also using tests to determine whether it's coming from the spine or the soft tissue. Now, some of the other causes of low back pain could be through accidents or an injury in the gym or during work, and those are also treatable by napropaths. And the treatment is similar, but through orthopedic and neurological testing, they can also determine the cause of the injury and also work with MDs such as orthopods or your internist. So there's a lot of different conditions with the low back, but the most common goes back to the mechanical low back pain that I had talked about before. Also, if you'd like to find a napropath in your area, you can go to www.naprapathic.org and go to the search Find a Napropath. And so napropaths are listed there in various areas. And you can find one hopefully in your area. Okay, we have a caller. Dave, you have a question?
Yes, I drive a truck.
Okay.
And I've done this for 35 years.
Okay. And you're having some low back pain? Hello, Dave?
Oh, we lost him. Hello. Can I, I'm going to try putting you straight through to Dr. Venice, okay? Oh, it looks like actually David came back.
Okay. Dave?
Actually, let me finish talking to you.
Red light.
He got interrupted.
Hello?
Hello.
What's your first
Hi,
name?
okay, so I have a question in terms of just low back pain.
Okay.
I have been told that a lot of women have low back pain, and I didn't really know how common that was or wasn't. And I guess I was curious to know if, like, sometimes if I laugh deeply or things like that, it's a little more intense. And I just want to know, firstly, if in your experience it's true that women have low back pain and that's common. And two, what are just like some of the things that I can do? Like I sit at a desk most of the day, and I guess that could be some of it that I can sort of do to just minimize it.
Okay. Yeah, I mean, it's common both in men and women. And as I was saying earlier with the mechanical low back pain, so if you're sitting at a desk for long periods, One of the things is, using the good posture, the picture that I showed earlier, that you maintain those curves. So devices like a lumbar support or just a small rolled up towel to keep the position of right at the center of the low back, you want to have a little slight curve there because that'll help minimize the low back pain through compression. The other is the exercise I had showed you because that'll also help straighten out your back by strengthening and stretching some of the muscles that get tight when you're sitting for long periods. So my best recommendation would be to try to, work on your posture. Also get up and stretch every hour so you're not sitting for long periods of time. And if you are, then every 5 minutes you should get up and stretch and kind of lengthen. So
Okay, and last question, Mike.
sure.
I just started yoga. Is that going to help, like, in terms of exercise? Is that one of the things you recommend?
Yes, yoga is very good for range of motion and improving your posture. So yes, if it's well taught, I think yoga is a great tool to create range of motion, strengthen some of the postural muscles, and just moving the joint. So yeah, I think that's great.
Okay, thank you.
Mhm.
Okay, this is Cornell.
Okay,
Yes, sir.
Cornell,
Yes, hello.
well, you have a question?
Yes, Dr. Venice. Again, my name is Cornell. I'm in the upholstery drapery business. I operate a workroom and have for the better part of my life. And I'm 45 now, and I am very, very active. But I have a condition in my right hand that's it's very painful. So my ring finger, to describe it best, is if I make a fist and I go to open my hand, my I don't have the strength no longer in my ring finger to pop it straight again. And I'll push my palm or I'll physically grab my finger and pop it back in place, but very painful and has me very concerned.
Okay. It sounds like, without seeing you, that you have trigger finger or tenosynovitis. And so what it is there's a condition where the tendon sheath and the flexors, which are the muscles and tendons that bring the fingers toward the palm, they can get inflamed, and the sheath then doesn't have space. The tendon in the sheath doesn't have room to extend, and so the reason it's called trigger finger is there's that kind of popping. And so if it's popping and it's painful, then you possibly could have trigger finger, and it is a condition that naprapaths can treat in a non-surgical, non-drug way. So you could go to find a naprapath and locate a naprapath in your area.
Well, I mean, what kind of treatment and what's done that I can look towards?
Typically what happens is ultrasound is a very good tool, which is a sound wave of heat that penetrates into the tissue and helps with inflammatory conditions like trigger finger, possibly electrical stim, soft tissue manipulation to free up the sheath and reduce the inflammation and increase range of motion. And then there's exercises that they can give you to strengthen your hand, so it's preventable in the future, but very treatable non-surgically.
And then is it a recurring condition after being cured, or something I have to really watch? Or
Yes, it could reoccur, but with proper care and strengthening and being careful with repetitive gripping type motion, you should have long-term relief.
Okay, and last question. Sorry
Sure.
to keep it so long, but lastly, how long is treatment generally for something like this?
Generally, for these type of inflammatory and tendon conditions, about 4 to 6 weeks, depending on the severity of the trigger finger.
Okay. Well, that's a lot. So, all right, doctor. I appreciate the advice.
You're welcome.
Thank you.
Take care.
Bye-bye.
Okay, I'm going to go to our website here, and this is the American Naprapathic Association. This is the website where you can find a naprapath. So if you go to www.naprapathy.org or call 312-698-9855 or email at info@naprapathy.org, then you can find a naprapath in the city or in the suburbs and in other states that can help you with the conditions I had talked about earlier. So that's a great resource for naprapaths in Illinois and outside of the state. Okay, we have a write-in question from Bill. He gets headaches from computer work. Any ideas? And yes, much like I was saying earlier about the mechanical low back pain, posture and sitting for long periods can have an effect on the whole spine. So from the cervical or neck through the mid-back or thoracic into the lumbar and sacrum. So one of the things to try to reduce with long sitting periods are stretches for the neck, and also making sure, like I was saying earlier, that you're not in flexion, that you're back into extension, meaning you're backward. So the more that you come forward when you're sitting at your computer desk, the more pressure through the spine, because as the head goes forward, the shear force then through the neck is increased. So you want to decrease that by keeping the head back. The other thing with computer work is a lot of people's monitors are not set up at eye level. So what happens is they have the monitor too low, and then their head goes down, and there's much more strain on the neck muscle. So you want to take a look at your setup, which is very important for low back, mid back, and neck conditions. So the first thing to look at is the chair. You want to be at slightly above 90 degrees, arms fully supported, and then as far as the monitor, you want it, like I said earlier, at eye level. And when it's at eye level, then your neck is in a neutral position. So if you're using two monitors, you want to have them close together, and you also have to be conscious of moving to the monitor if you're having neck pain. So once again, if you could visit the Naprapathy website, find a naprapath, they can help you with exercises and relieving your headaches, which could possibly be from tension headaches from the computer work. So those can be relieved through naprapathy by reducing the tension on the muscles, and through exercises and postural exercises to help improve your pain and headaches. Okay, we have another write-in question from Gary. I get pain in my right buttocks when I drive. Can you help? Yes. With glute pain, what may be happening is you may be putting more pressure on the sciatic nerve by, your chair is off or your positioning is off in your car. So one of the things that you could do is have a naprapath evaluate the condition and see if it's coming from the soft tissue or if it is a low back problem coming from the nerve roots. And so through orthopedic and neurological testing, they could find out if it's a soft tissue, meaning the musculature, or if it's coming from the spine, and determine where the pain's coming from. But yes, that's also very treatable by naprapaths, because possibly it could be that your weight shifting, so you're loading to that right side, and it could be causing pain on the sciatic nerve through the musculature, and that can be determined through orthopedic and neurological testing. So yes, definitely is treatable by naprapathy. Thanks for your question, Gary. Okay, so let's go back to mechanical low back pain. Some of the things that people are doing now with good success are moving to stand-up desks, especially if you have a previous back condition. By standing, you're going to decrease the pressure on the spine, and because when you're sitting for long periods, the mechanical stress is very great, and if you're sitting in poor posture it increases quite a bit. So you want to decrease that load on the spine, and by moving to a stand-up desk, if allowed by your employer, it could be a great way to decrease your back pain. And there's several places in Chicago, back stores that are selling the stand-up desks. So they're a great option for low back pain, neck pain, as long as the setup, once again, is correct. So that your monitor is at eye level and that the desk is set up that you're at 90 degrees with your arms, you can decrease the load on the shoulders, neck, and low back. So the stand-up desks are a very popular tool to improve the load on the spine.
So I'm going to put you on. I'll put you on hold. Also, Mike, when we come on, could you turn your radio down, please?
Okay, we have another caller on the line.
Okay, Mike's on. Mike.
Okay. Mike, you have a question?
Yes, I've been to a naprapath and had horrible pain, and it's amazing. I mean, I've seen him now for about 4 years, and
Great.
but right away my back pain was amazingly. Gave me some exercise. He really treated me, and did some electric and ultrasound, and gave me some exercise. It's like $1 million.
Great.
Well, I just want to commend
how often do you,
everything that you guys are doing.
how often do you see your naprapath?
Oh, and I'm only seeing him like once every 2 or 3 months.
Oh,
But
great.
at first, I saw him like once a week, or but pretty. I mean, it seemed like it lasted. I mean, it seemed like it took maybe about 3-4 weeks before. I mean, I was feeling no pain at all.
Great. That's kind of the response that I get typically,
So-
depending on a problem, whether it's in an acute or chronic stage, to get you to a maintenance where you're not having constant treatments, and through exercise and maintenance treatments, the condition, should be at bay. That's great to hear.
Yeah, I mean, you've given my life back. I thank you very much.
Sure, you're welcome. Okay, Pam has a question, a write-in question. I slipped on some ice a few weeks ago. It has gotten better, but still hurts. Should I see a naprapath first or my doctor? It's probably recommended that you see a internist first, and just to rule out, to do x-rays, and then a referral to a naprapath. So that's the route I would go, is internist or orthopedic first. They can do imaging if need be, and then they can refer you to a naprapath just to make sure there's not a fracture or something else underlying going on, and that would be a way to handle it, because normally orthopedics and internists will refer back to us. They'll have the imaging, and then we can create a treatment plan based on their findings and through our own orthopedic and neurological testing, just to continue with care. So that would be a good way to go. Thanks, Pam, for your question. Okay, so once again, the American Naprapathic Association can be found at www.naprapathy.org. Find a naprapath. And we're still taking some calls. So if you'd like to call in with your questions, that would be great. Okay, we have one more quick question. Do you crack my back? This is from Tim. Do you crack my back or just massage? We do a combination of treatments. There's no cracking, but through soft tissue manipulation, there may be some pops. A lot of naprapaths do soft tissue work as well. So it's not the chiropractic high velocity manipulation. It's a more gentle soft tissue manipulation with some other soft tissue work. So thanks, Tim, for the questions. Okay, we're going to wrap it up. My name again was Michael Venice, and I'm with the American Naprapathic Association. which can be found at www.napropathy.org. And thanks for having us.